being a member of our senior leadership team, I think really having communication about the fiscal realities that healthcare actually is facing, has faced for a number of years, certainly through the pandemic was really challenging, et cetera. I think that, the idea that we're all in this together, a culture of really the highest and best use of resources for the good of the organization, the good of the patients that we're privileged to serve. I feel like that's really become a little bit of a sense of responsibility, in the organization. So again, as we then talk about resource allocation to high impact areas, when it comes to new resources, I think again we're being very targeted and identifying, again, what is the highest and best use of those resources for the organizations and those that we serve. I think that, communicating that, which again, isn't always easy, because again, I think that many areas feel that they need additional resources to do the work that they're doing well, and making sure that we're being transparent in terms of really what the financial situation of the organization is, and then even sharing that when we do actually allocate some additional resources, what went into the thought process, what went into the recognition that really was a high impact area for people that we serve. And then, again, oftentimes I think that it comes up that, well, the patient care areas are the high impact areas, and certainly they are. They're certainly towards the top. But I also recognize, and again, Pat had indicated that, the situation for St. Jude's may be a little bit different, but for organizations like ours, revenue cycle, right? Revenue cycle is an area that we don't want to shortchange resource allocation, because those are the employees that actually make sure that we get the prior authorizations and get the services approved, and then get payment from the payer as quickly as we can, and fighting the denials and the overturns, et cetera, that actually are just consistent in today's environment. So I think that's what we're doing in our organization, really, is trying to be transparent, and I'm sure that we could always do better at that, but we're certainly making an effort to do that, and really making sure that we are prioritizing those high impact areas.